Welcome to this edition of Security and Compliance Weekly. Today we're talking to Jordan Wiseman. He's a principal consultant at Online Business Systems, the place where I work, which makes him a friend, a colleague of yours truly. Jordan is going to help us do a deep dive into HIPAA today because it occurred to me after 78 episodes of Security and Compliance Weekly, we haven't talked about HIPAA yet, so I thought it was long overdue. And Jordan graciously accepted the challenge to come in and facilitate a discussion. As is my desire in all things, we're going to start with a little bit of a quick HIPAA primer, just to make sure we're all on the same page. And then we're going to talk about some of the challenges that companies, organizations face trying to meet their HIPAA requirements, what they might be, talk about current events, whatever comes up, because all of us are chomping at the bit to talk HIPAA. So if you're ready, put on your paper gown, put all your valuables in the locker, get ready to draw blood, and have your vaccine cards ready, and join us as we continue our journey of tearing down silos and building bridges on Security and Compliance Weekly.
This is Security Weekly, for security professionals, by security professionals. And now, it's the show that bridges the requirements of regulations, compliance, and privacy with those of security. Your trusted source for complying with various mandates, building effective programs, and current compliance news. It's time for Security and Compliance Weekly.
And welcome to episode number 79 of Security and Compliance Weekly, recorded on July 13th, 2021. I am your host, Mr. Jeff Mann. As you can see, I am in studio, which is so exciting. I'm here for the week, so I'll be here for Paul's Security Weekly later on Thursday. So excited to be here and seeing, my family, Security Weekly family that I haven't seen in 16, 18 months for some healthcare related reason. Joining me today are my co-hosts, Mr. Scott Lyons, Mr. Josh Marpet, and Mr. Frederick Lee. Gentlemen, welcome. Wish y'all were here.
So do we.
Someday. Hey, don't forget, security.
We were there before. We'll be there again at some point.
You'll get back here, and hopefully you'll feel better next time, Scott.
I know, right?
Hey, don't forget, Security Weekly Unlocked is coming up in person this December 5th through 8th at the Hilton Lake Buena Vista. Our call for presentations deadline has been extended through July 23rd at 11:59 p.m. Eastern Time. You can visit securityweekly.com/unlocked to submit your presentation. We want you to come talk at Unlocked. Also coming up, here we go again. July 14th. What is that stupid thing called? We've got a name for it. No. What do we call it? Democast. That Democast. Sorry, I had to back up, which we can't do apparently. Democast is coming up July 14th, and it is going to be how to protect your entire attack service. July 15th, that's at 11 a.m. Eastern Time. July 15th at 11 a.m. Eastern Time, we're going to have a thoughtful approach to SASE and how that can improve security and enable scalability. And maybe we'll even find out what SASE stands for. Finally, July 22nd, our technical training, also at 11 a.m. Eastern Time, we'll be learning how guided SaaS NDR enables rapid response. You can sign up for all of these webcasts by going to securityweekly.com/webcasts. And also, of course, if you have a desire to see any of our previously recorded webinars or technical trainings, they are available at securityweekly.com/on-demand. All right, on to the show. It is my extreme pleasure to introduce you to one of my favorite colleagues at Online Business Systems. And I say that probably because he mostly agrees with me on things that we see are wonky and wrong. We were just doing it in the last hour. We had a client trying to pull a fast one, and we're like, where's this coming from? Anyway, I want to welcome Jordan Wiseman to the show. Jordan, welcome.
Hey, thanks, Jeff. Thanks for having me, everybody. Nice to be here and see everybody. And I'm particularly excited to be diving into some healthcare information security and privacy topics today.
Well, we always like to start out with learning a little bit about our guests, Jordan. So tell us a little bit about yourself, your background, how you got into security. And I'm particularly interested, especially for our audience, for you to share how you decided to make the jump over to more the consulting advisory side of the world rather than the in the trenches tech type person. So please tell us a little bit about yourself.
Sure. Yeah, I've been dealing with tech and security since the late '90s. I started doing that mostly because I think the joke of what I've told people before is that I kind of discovered unprotected systems meant that I had free resources to play with, and that's kind of how I got going on things. Not so much hacking, so much as really just kind of squatting in other people's places, other people's technology systems. I started professionally actually in the healthcare space, which is why HIPAA is something that's near and dear to my heart that we'll talk about a little bit later. And I was on the engineering side, so dealing with security and privacy, big iron Unix systems, underlying, healthcare environments, that kind of stuff for quite a while. I jumped over to the consulting side, mostly because I got tired of not being listened to quite as much. When the advantages of being a consultant when you go to places to make meaningful change or to help people, improve security is you come with that assumption of expertise in security. And so sometimes it can be an easier, more effective way of making a meaningful difference in the lives of data, I guess, in this particular case.
Some might call it expertise. Some might call it the raw power of, oh crap, it's the auditor, because they always call us auditors, and they know that they have to do something. So
yeah, well, it's also that idea that they're paying you for your expertise. The fact that they're giving you the money for in the first place comes with some implied trust that makes greases certain wheels that would be more difficult to get rolling otherwise.
Great.
Well, I mean, that implied trust comes from the top, not necessarily from the people doing it. So, the practitioners.
True.
So you've got the implied trust in the people who are like, here, have multiple thousands of dollars to check out what we're doing. And the people actually doing it are like, I'm fine, leave me alone.
Well, and sometimes that's a double-edged sword that works the other way. Years ago, I was working on setting up a virtualization infrastructure for another hospital system that I was at, and they wanted to bring in one of those trusted third parties, those consultants like I am now, to provide that third-party validation that I was doing the right thing. And the guy who showed up to do the work was the guy I had helped in class.
Funny.
We had a good time.
Well, we also like to start our shows with asking our guests what we call the hot seat question. And that is simply because this is a show about security and compliance, and especially since you've sort of worked both sides. What is your take on this thing that we call the security versus compliance continuum? Where do you fall?
I think that if done correctly, and security is implemented not just according to best practice, but according to what makes sense, compliance should be no more complicated than demonstrating you're doing the right things. Now, I realize that for a lot of compliance schemes that there's a lot more T's to cross and I's to dots in terms of specific details that have to be handled and specific things that have to be demonstrated for that particular compliance scheme. But I don't really like the idea that it's an adversarial kind of security versus compliance thing in the most part. I think, one of your old favorites, Jeff, is a perfect example, PCI. PCI is a collection of, you guys have talked about this a whole bunch, practical, reasonable security controls that could be applicable to almost any environment. And if done correctly, compliance should almost be automatic, except for the evidence. And that's kind of my perception on it. There's no reason that you can't do both. There's no reason that doing security correctly gets in the way of compliance, or more importantly, the compliance needs to get in the way of security. And I think that's where a lot of organizations fall down, is they focus too much on needing to get that piece of paper that says they meet a certain standard. They focus too much on what evidence needs to be collected. And unfortunately, sometimes that takes them away from the actual more important practical side of ensuring that data is actually secure in the first place.
Interesting.
So I'm not sure if I answered that question or not, but that's kind of my rambling opinion on it.
Well, I mean, it's an opinion question. There are no right or wrong answers. We're just trying to get to know you a little bit and just get a little bit inside your head and, understand where you're coming from. I find that helpful in terms of having a conversation with anyone, is just to, try to get to know a little bit where they're coming from. I may agree or disagree with them, but at least I know where they're coming from. So let's...
I was just going to say that brings an interesting point. If we take that a step further, I said one of the other things that I've spent a long time kind of focusing on in my career is this idea that security and usability also are often kind of seen as conflicting ideals, and they don't necessarily have to be. I've always been a fan of engineering systems in a way that makes it easy for the people that actually need to use them. I mean, too many IT people forget the fact that IT is a service organization within a company, third party, whatever it is. Other people need to use their computers to do a job. Implementing security correctly, especially in terms of things like adequate access controls and least access and stuff, means they can do what they need to do, and you shouldn't be needing to get in their way in terms of doing that thing. And there's interesting strategies for that, and we can have a whole separate discussion about UX design and workflow design and all that kind of stuff. But to me, that's also really kind of important aspect, because if you get those things right, it's much easier to get the buy-in you need to do security and monitoring correctly, and it makes it much easier than to get those pieces of paper to validate you meet the standards that you need.
Yeah, I certainly agree with that. I can remember one of probably the worst client I ever had from a perspective of this was a director of security. I don't think that, CISO wasn't in vogue. This is going back probably 20 some years. But it was a healthcare organization, and this guy's attitude was, I am Lord and God. What I say goes. I don't care what anybody thinks. We are going to do this. We're going to do it my way or the highway. And you can imagine he was not a very popular person, and he had very little success in implementing the right kind of security program. But
that was how many years? You said that was 20 years ago.
Yeah.
So 20 years ago. It was, we have our silos, we have our fiefdoms, we have our ways of doing things. And I would argue and posit that CISOs in the last 10 years, 5 years especially, have had to learn corporate politics, have had to learn how to negotiate, have had to learn how to get along. You can't just merely dictate, and that's the way it will be anymore, because it doesn't work that way.
No, the silos are still in place. Why is the tagline of our show tearing down silos and building bridges?
Well, no.
Right?
The silos,
if those silos were gone, if we have actually learned from our mistakes, then we as security professionals would not have to constantly beat the drum of do the basics, check your passwords, train your users. We wouldn't have to do this, but guess what? We still do. So I'm actually going to go against what you're saying.
Well,
I think you're both right. I think the silos are still there, but I think the way that you tear down silos is you do all the, I hate to call it the touchy-feely things, but if you help people understand the context and the reason why they need to do something, and if it's not going to impact their work, and it, in some cases, it might even make their job easier. It might eliminate some steps if when things can be automated and things like that. So I think you're both right. But let's move on to HIPAA.
Soft skills, not touchy feely. But actually,
I like touchy feely. Is that inappropriate?
No,
depends on how touchy
or for HIPAA, we should say I like to palpate. Isn't that the medical term?
It's actually very apropos because of the way that we deal with people and the way that we talk about dealing with people, especially trying to translate tech to business. A lot of people are touchy-feely with these subjects, and we have to, as IT people, take that guarded risk, if you will, of somebody that we're explaining this stuff to might not understand what we're talking about. So how can we play with kid gloves? How can we, play touchy-feely, with being very careful about where we step and ensure that we're getting the point across?
Well, I think part of that is definitely realizing that some people may not understand the deep esoteric technical things that we're talking about, and some of that for us, especially from the engineering side, is being able to take that humility to recognize that we need to improve those skills. I worked as an engineer for all those years, and when I went back to school to finish my degree and do all that kind of stuff, I went to business school, not to tech school, because I recognized that I picked up a lot of skills on the fly and I could deal with all these complex topics, but I needed to learn the business side of things, those so-called soft skills that we're talking about now, not just to help break down silos, but to make me more effective. If I wanted more money to spend on the things that I wanted as an engineer, as a security professional, do things correctly, I had to be able to make those cases to business people who didn't understand the tech, but they understood the business.
Right. So let's put that in the context of HIPAA, and I really want to start off with, I don't like to assume that anybody knows what any terminology is that we're using in this industry, because very often I find out that people don't actually know what things are. So tell us a little bit about HIPAA from a high level. What is it? What is it all about? What are the goals? And you know, especially how it applies to security. You know, what is it about security within HIPAA that makes us all have to do HIPAA, or so many of us have to do HIPAA?
Sure. Well, let's kind of start at the beginning. So HIPAA is the Health Insurance Portability and Accountability Act. Now, you notice none of those A's and none of those P's were related to privacy or security and that kind of stuff, although accountability kind of matters.
Jordan, I'm sorry, it's actually health information.
No, it's health insurance. If you go look on HHS website and you actually read the act itself, it's Health Insurance Portability and Accountability Act.
If I'm wrong, I apologize.
Well, I thought for years that it was insurance.
Health insurance.
Our health information also, and our. I was recently reminded that that's not the case.
Right.
The original point of HIPAA, which that gets right back to, was actually about easing access to healthcare by making it easier for healthcare providers and organizations to share information so that they could actually bill. I mean, the
Bill
health
properly,
insurance system here, the health insurance system here has been and is still. There's a lot of room for improvement. Things have been a lot better, but HIPAA kind of started off as a way of standardizing. Well, it's an entirely different discussion we can get into later. But
we will
take a drink and we'll get there
on the second. Yeah, we will get there. Oh yes, we will. It will happen.
So the idea was standardizing how organizations would share that information and prepare for doing it electronically. I mean, that was kind of the idea. And when they created that rule to make things easier, or to create that law to make things easier, they recognized that, well, encouraging folks to do electronically is going to expose health information to the same kind of problems. I mean, this was back in the late 90s when they were talking about all this stuff during, you know, the birth of the .com era and all that kind of stuff. And they were seeing, you know, credit cards were being stolen and skimmed and that kind of stuff, because, you know, that doesn't happen anymore. But politicians and people were afraid enough to recognize that they needed to add requirements in here, not just to protect the health information, but to ensure that it was used appropriately. And that's kind of really what the where HIPAA, you know, came from, is standardizing, you know, encouraging use of electronic systems and standardizing the exchange of that information, mostly for insurance and billing purposes, with an eye towards doing it securely. And this kind of steps into an area that a lot of people outside of healthcare especially have misconceptions about what HIPAA protects and what it does and who it applies to. So HIPAA says that healthcare providers, healthcare plans, so your insurance company, and then clearinghouses, so organizations that enable those two to talk to each other, like the middleman from a data interchange kind of capacity. The people who create or receive health information is who HIPAA applies to. So it doesn't apply to your employer necessarily. I mean, there's like everything, there's a lot of it depends there. It doesn't apply to your friends or colleagues or kind of other folks, but it specifically is about those people who you normally expect to handle and deal with your health information. And it implies rules or enforces rules on them that they have to do to protect that information, to keep it secure from a risk-based perspective. In fact, HIPAA is one of the few standards that says you not only have to assess the risk to the data that's covered, but you actually have to do something about those assessments, which implies checking it again. In fact, HIPAA has a specific rule that says not just do the risk assessment once and apply some risk treatments. It says you have to periodically make sure that they're still effective and that they still apply and that you don't need to do more stuff. On top of that, it also has, you know, as everybody is kind of aware of and most people assume HIPAA has to do with privacy, it actually imposes a set of rules on those organizations in terms of what they can and can't use your health data for, with or without your permission. And most of those rules are designed to allow those organizations to share it to better treat you. You know, if you go see your doctor and you've got something that they've never seen before and they need to bring in another doctor, HIPAA says they can do that. They don't need necessarily to go and get your permission again to bring in another doctor to discuss your case. They can't discuss it with other people who call and just ask and want to know about your position, that kind of stuff. That's not allowed. It also has provisions in there related to public health. So this is kind of on everybody's mind related to the COVID pandemic we've just went through. HIPAA allows hospitals and your doctors to share information with public health authorities so they can do things like track incidents of infectious disease that is making life problematic for lots and lots of people. I mean, those are just a couple examples. But
you are so diplomatic. You are so effing diplomatic.
It's habits and things I got from the business school, you know.
little infectious disease issue that some people are having problems with. Worldwide pandemic, man. No, seriously,
fair enough.
Well done.
And that's something that probably should be stressed a bit more. That it's not just a little problem some people deal with. This is a big freaking deal that folks need to take a little more seriously. But I'll get off that particular soapbox.
So when I first went to work for Tenable, 8 years ago now, I came in being hired as the PCI expert, but I was immediately branded as a compliance expert, and very
That's
early
what
on,
PCI means, right?
they wanted me to do something with HIPAA. I'm like, I don't do HIPAA. I've never done HIPAA. So I started looking into HIPAA. I said, well, how hard can it be? And I like to start at the beginning and start with basic definitions. And I was very immediately frustrated and kind of perplexed that I couldn't find an actual definition of the type of data that HIPAA seemed to care about, which was personal. What does PHI stand for? Personal healthcare information?
Protected health information.
Protected health information. I couldn't find just a short, succinct in the HIPAA documents, the charter, whatever it's called. I couldn't find a definition of PHI. I found lots of examples. I found better supporting documentation that came closer to a definition. Sure. So let me ask the stumper question: what is PHI?
All right, so we'll go down the rabbit hole.
You'll know it when you see it.
Pretty much.
So laws like source code involve a lot of references to other places and variables. So you have to look in a couple different places to pull all the details together. But protected health information essentially is three things. It is personally identifiable information about an individual related to their current, past, or future, like expected health condition, the provision of health care to that individual, and the payment for that health care. And that's kind of really it. There's a couple of loaded terms in there. There's a couple of loaded terms in there, like identifiable information. So is all PII PHI? No, but all PHI is by definition PII. Does that make it clearer, muddier?
Clear.
Is that like saying not all systems are compliant but secure, and they're secure but not? Wait.
Yeah.
We'll come back to you, Scott.
Can you unmuddle all of that?
Sure. So at a more basic level, it's information about a person's health and their health conditions. So whether you've got a cold, whether you've broken your arm, whether you're sick with a chronic condition or something, any of those things, that can uniquely identify you as a person. So health records are one of those things that it's hard for people to change over time without doing things like severely hurting themselves, injuring themselves, or getting further sick. But anything related to that stuff that can uniquely identify the individual. So PII related to health condition and health kind of stuff is essentially PHI, as well as information related to the payment for that data. So financial records that you use to pay for healthcare stuff, and mostly that's because one, HIPAA applies to insurance data, but two, that's an easy way. Follow the money is the way you tie activity to somebody, and that kind of gets to identifying individuals here too.
Does that include? And sorry for going a little bit down a rabbit hole. In terms of payment, does that include not only the co-pays and what the patient is paying, but also what their healthcare provider, their insurance company is paying? It
can, yes.
All right, interesting.
Like everything, it depends, of course, but yeah, if it can uniquely identify the individual, if you can tell if you can tell that I was seen by my neurologist based on the amounts that I paid to which specific organizations, that's uniquely identifying health information protected by HIPAA.
I guess,
and Jordan.
Oh, go ahead, please.
Does all of this information have to be combined with treatment and payment, or is it just sufficient? Would a definition of PHI literally just be a person's name and whatever their medical condition is? So, for example, if I'm diabetic, just knowing like, hey, Flea, somewhere in some of the records, like, hey, Flea is diabetic. Is that in itself just PHI, or does it have to be associated with Flea is diabetic and here's his insulin prescription and here's how he paid for it?
So the fact that Flea is diabetic could be PHI if it's associated with one of those organizations we talked about before. So a healthcare provider, a health insurance company, or one of the health clearinghouses. if that information is not already public. That's one of the exceptions out there. If that information is already public, if you've gone out there and tweeted about your diabetes or your care or whatever, then that information itself may not be protected because it's already public. So it's not necessarily that it's associated with specific details of your treatment, but it has to do with who owns and controls that information, what they're doing with it. So if you posted that online, for example, that's not necessarily PHI, even if you would consider it sensitive. If you're a family member of yours, if your boss knew that at work and they posted that somewhere online, that wouldn't necessarily be a HIPAA violation because they may not be a covered entity. Right. But if your doctor started talking to other people about it or posting it online, or maybe even if you had developed a diet regimen that was really, really good for your type of diabetes and your doctor wanted to tell the world about it and started giving talks about it on stage, identifying you specifically, that could be a HIPAA violation if you didn't give them your permission to do that.
You used a term, Jordan, that I would love to actually extrapolate on, which is this idea of a covered entity. I know one of the things that a lot of companies wrestle with is whether or not they have HIPAA requirements. Like, are they an entity that should be concerned around this? A great example is kind of like some of those entities that are, for lack of a better word, almost like common carrier. I think about one of my previous companies, Twilio, which obviously did a bunch of telephony. You think about a company like Twitter, and kind of as you mentioned, like, hey, posting stuff on social media. And I'm kind of curious, like, where that line is drawn between who should be a covered entity and who shouldn't be.
Sure. So I talked about those three types of organizations before that are the ones HIPAA specifically applies to, right? So health insurance organizations, healthcare providers, and the healthcare clearinghouses, those middlemen that sit between them. A covered entity is any one of those three that creates or receives protected health information from another. Organizations so there's also kind of gets in the murky area of what are business associates, which we'll talk on a little bit, but that's essentially what a covered entity is. It's one of those three type of organizations that creates or receives health information from one of the others, which as you can imagine, leaves out a lot of other potential organizations. There's also the concept of a business associate under HIPAA, which is a third-party organization who provides related services to one of those covered entities, and who receives protected health information from them to do something with that data on their behalf. So it's not necessarily any organization that receives PHI, which is kind of one of those interesting details that matter a lot. A lot of health organizations assume that anybody that receives PHI from them is a business associate, but that's not necessarily true. For example, if they work with a third party, contracting organization to do their, say, medical billing, for example, if that billing provider is actually working as a member of their staff in their office and that kind of stuff, they're a contractor, but not necessarily a business associate, unless they were to send that data to the third party and it to be handled off that way. And there's some technical details there, but everybody has, they already have to ensure those people meet the same rules, which is getting into a different topic. But does that kind of answer the question?
Oh, yeah, that definitely answers the question, and I'm glad you already jumped into business associates. Because I'm also kind of curious, and I think it's one of the areas that people get confused about. Like, what are the requirements on business associates? We think a lot about this idea of people signing these BAAs, and would love you to actually define BAAs for the audience. But I'm also just kind of curious, like, how does somebody even recognize that they're in that space?
All right. Well, I'll have to give the standard disclaimer. I'm not a lawyer, but let's talk about. So, a business associate, like I said, is a third party who receives protected health information from a covered entity. So, one of those three types of organizations who created or received the PHI in the first place, to do something for the benefit of that organization. So, it could be billing, it could be monitoring, it could be a lot of times organizations get involved with things like quality metrics, monitoring and reporting, or that kind of stuff. A business associate agreement is something required by HIPAA that a covered entity is supposed to have a business associate, one of those third-party organizations that's working for their benefit, to sign that essentially says they have to abide by all of the same rules in HIPAA in terms of the securing the protected health information they've got, using it for the acceptable uses as defined by the privacy rule, and all of that. Interestingly, the HITECH Act that passed in 2013 amended HIPAA to say essentially that business associates have to comply with all the rules regardless of whether a BAA is in place or not, What the BA serves to now, in addition to getting agreement that those organizations will follow all the rules, is also to identify who owns the data and who's responsible for it. Like a lot of privacy regs that we're dealing with these days, because it's being more popular out there with GDPR, and people talk about controller and processor relationships, or under CCPA where you've got third-party relationships from the owners and that kind of stuff. Under HIPAA, the covered entity still is the one responsible for the data. And if the business associate has a problem with security, if they get breached or whatever, they have to notify the covered entity immediately, but it's still the covered entity's responsibility for that data for the most part.
All right, time out. Define business associate.
A business associate is a third-party organization who receives protected health information from a covered entity to do something with it for that covered entity's benefit.
Okay.
So yeah, and the business associate agreement is sort of what contractually kind of enforces that relationship and those controls, and it's kind of an extra control now because HITECH says that HIPAA applies to business associates anyway. Third parties who aren't necessarily business associates but are still dealing with or working with a covered entity or with a business associate, and you have to rely on more traditional data security agreements for those folks to make sure that if they happen to see PHI, if they're dealing with the systems for like, let's say they're not receiving PHI for helping the organization, but maybe they're providing support services. You've outsourced your help desk to a third party, and they may inadvertently, or they may, in the course of doing their business, come into contact with protected health information in your environment. Well, they're not necessarily a business associate, but by contract, you have to enforce rules that they will take the adequate steps to protect the information that wouldn't necessarily otherwise be covered because they're not a business associate. So HIPAA wouldn't necessarily apply to them without that other contract.
So if somebody's not following the rules, what's happening to them?
That's a great question.
I guess more generically, the question I wanted to ask is who's the enforcer in all this, and what are the consequences?
Sure. So
the enforcer.
HIPAA is a U.S. Federal regulation, and it's enforced by the Office of Civil Rights. So HIPAA carries with it not just the requirements for these rules, but it actually comes with civil and monetary penalties. It doesn't create a private right of action. In other words, you couldn't sue necessarily your hospital directly for a HIPAA violation. There's a lot of ifs there, of course, because there's overlap with state laws and a bunch of other stuff. But the federal government can enforce civil penalties, so they can fine organizations who aren't HIPAA compliant, and they can enforce criminal penalties if those organizations are I suppose it's more for egregious kind of things. But if an organization knowingly or willingly doesn't protect the health information, or worse, does something with it they know they're not supposed to, people can be thrown in jail for it, and have been thrown in jail for it.
Wow, that's different.
We have HIPAA here in the U.S. We've had HITRUST come in and HITECH try and come in to enforce it, and we have HITRUST, which has even heavier penalties and fines if you're not following it. What do we have in Europe? Like, what's the equivalent over in Europe for this? Is it GDPR?
Yeah, so GDPR is probably the most direct analog. In fact, a lot of how GDPR was structured, in fact, how a lot of the privacy regs are structured, borrowed a lot from HIPAA's approach to this kind of stuff. Other than GDPR over there, as far as I'm aware of, there may be different rules in each country. And in fact, that's something here that we have in the States too, where the federal government has HIPAA and it's got those civil and criminal penalties associated with it. But individual states can actually enact laws that are more strict and more stringent than HIPAA. And that's true for countries in Europe and elsewhere in the world as well. It's worth noting, in fact, that a lot of the extra protections here in the States, things you would consider special category data in GDPR over there, related to highly sensitive conditions. So maybe, someone's HIV status, or someone's dealing with substance abuse problems and that kind of stuff. Most states here, so there are some additional federal rules for that, but most states here more strictly protect that information than even HIPAA goes, to the point where it may not be possible for a healthcare organization even to admit that patient is receiving that kind of care.
Right. And the big differences between HIPAA and GDPR come in the form of consent and the right to be forgotten. Consent, GDPR explicitly makes it mandatory versus HIPAA, which says that the disclosure of some for the treatment purpose, and then the right to be forgotten under GDPR, individuals can be forgotten, or they can have a request to delete their data, versus HIPAA, which doesn't grant this right. So do we see businesses that fall under HIPAA retaining that for the life of the patient, the life of the data, data destruction rules. Where does that fall into place? Because knowing where our data sits and who uses it and how it gets folded, spun, manipulated is really a big issue that all industries are facing when it comes to information security. Like, that's one of those hot button topics. How does the data get handled in something like that?
That is a fantastic question. And the simple truth is it's a difficult question to answer, and it's kind of a mess. So let me give you an example. So when I was working in the healthcare space on the other side of the table from consultants, for example, I was working for a public hospital district. And in the state of Washington, which is where I live, there is a state-provided schedule of data retention requirements for public hospital districts. It's 138 pages. Because not all of the data involved, even if it involves your health information, is necessarily your data or about you. For example, healthcare hospitals that do implant medical devices in individuals have requirements from the FDA and the other agencies that deal with those kind of implantable stuff to keep records of those implants, every single device and every single serial number for that device that went into every patient. And they need to track it for safety reasons in case there's ever recall or whatever else. You wouldn't necessarily want or be able to ask the hospital to get rid of that information, and they have to keep it for, I think that particular information they have to keep for the life of the patient itself. That's also true for all sorts of different medical stuff, because all the data that's there that's about your treatment for care isn't just about your health. It's about the performance of the healthcare providers that are dealing with you. It's about the safety of the tools and techniques and devices that they're using with you to do that. It's about the practice within that organization. So getting back to that question for you, yeah, it's you have the right under HIPAA to request a copy of all the health data, your medical record, those kind of details from you, or from the healthcare providers. But the records themselves, their documentation for how they're treating you and dealing with that kind of stuff, actually isn't your medical record. It's their business records.
Right. And you were talking about medical devices. Are you saying stuff like Pfizer, Moderna? Wait a minute, that's not a medical device.
Things like pacemakers and stents and that kind of.
So being 5G compliant is not high on the list.
well, there's a whole lot of safety stuff related to that kind of stuff, to be honest, because things like pacemakers, you don't want a pacemaker to deal with getting interference from high power transmission devices. Not that 5G is any kind of danger to those kinds of stuff, but you do want
the truth, man. Tell the truth.
5G is safe. That's the truth. If you want people to let's say you get a pacemaker and they discover 30 years late down the road that, oh, hey, when somebody has this model cell phone or maybe they've got this other kind of implanted device that they may actually interfere with that pacemaker, and they don't discover that for 30 years, you still probably want to know about it and take whatever steps needed to keep your pacemaker working, right? So that's one of the reasons I keep all that kind of data.
Hey, let me jump in real quick. We need to take a break. We'll come back and we will re-engage with this fascinating discussion. Be right back.
We're proud to announce CISO Stories, a new podcast series in partnership with Cybersecurity Collaborative and Cyber Reason. CISO Stories features the candid perspectives and experiences of frontline senior security executives and dives deep into timely security topics. CISO Stories is hosted by Todd Fitzgerald, VP of Cybersecurity Strategy at Cybersecurity Collaborative, and Sam Curry, Chief Product and Security Officer at Cyber Reason. Listen weekly as they speak with extraordinary CISOs by visiting securityweekly.com/CSP.
Welcome back to the HIPAA edition of Security and Compliance Weekly. Hey, Security Weekly is more than happy to announce that we will be at InfoSec World 2021, which will be held in person October 25th through 27th, 2021. This year, our annual partnership with InfoSec World is extra special as we're both business units under the Cyber Risk Alliance brand. What does this mean for you, the Security Weekly listener, and InfoSec World attendees? It means you'll get to see and hear from many of the Security Weekly team at the event, and you will save 20% off on your World Pass. Visit securityweekly.com/ISW 2021 to register using our discount code. Also, if you want to stay in the loop on all things Security Weekly related, go to securityweekly.com/subscribe to subscribe on your favorite podcast catcher or our YouTube channel, or you can sign up for our mailing list. You can join our Discord server, or you can follow our live streaming platform, Twitch. All that fun stuff. All right, let's get back to the discussion. I wanted to reset a little bit and try to focus a little bit on the security aspects of things for at least a minute. You referred to what I'm hearing is there's a lot of goals of implied security, data security within HIPAA. What actually are the specific security requirements? How, are they HIPAA themselves? HIPAA because it's a federal thing? Do they point to, God forbid, I mentioned NIST documents? What do companies actually have to follow? And part two of that question is, who enforces it? I see everything through a PCI lens where, third parties have to come in and independently assess whether a company is following all the security requirements within the PCI data security standard. Compare and contrast, if that makes sense, or just what is involved when an organization has to do HIPAA, from a security perspective, from security requirements. Tell us a little bit about that.
So HIPAA is a little bit of both. So they do kind of mandate best practices. They make reference to things like HIPAA standards, but part of HIPAA is what's known as the HIPAA security rule, which is actually part of the law that outlines a specific set, outlines a set of controls. They call them safeguards under HIPAA, but there's administrative, technical, physical, organizational safeguards, as well as some requirements about documentation you have to maintain related to those things. So policies, procedures, outputs from audits, and that kind of stuff. Unlike some other compliance schemes, there's not actually a certification body for HIPAA. There's no requirement that you be audited and that you get third party to sign off and say that you are HIPAA compliant. Most organizations want that, however, because it helps to demonstrate that they did the due diligence necessary in the event that a complaint is lodged against them with the Office of Civil Rights, which is the federal agency that's responsible for enforcing the HIPAA itself. So we've talked a little bit about HIPAA security, and that's codified within the HIPAA security rule. HIPAA also has a couple of other related rules that are worth talking about. One of them is the privacy rule, which is kind of the other half of the major piece of HIPAA that talks about what those covered entities we mentioned before, so healthcare providers, insurance organizations, and clearinghouses, what they can use health data for, what they need patient consent to use health data for, and what they can't use it for without the patient consent. That's all under the privacy rule, which also says that you have to apply safeguards to protect the privacy of the information, but not just its security. There's also the breach notification rule, which is worth noting that's where the HITECH added those higher penalties that was mentioned earlier. But it's essentially what says if there's a breach of protected health information, the covered entity has to notify the patients affected, notify the federal government, and potentially notify the public if the breach is over 500 records. And you have 60 days to do that. So 60 days from when you find out, not 60 days when you decide that it's a problem. And And there's also the enforcement rule, which is kind of what pulls in OCR and actually empowers them to go after folks with those civil and criminal penalties we mentioned before.
But companies they're not reporting to OCR that they're compliant. That's not OCR's function.
Right. It's not required.
Who is typically, or what entity or organization or individual is typically going to OCR and saying, I've got a problem with XYZ healthcare company?
For the most part, it's patients whose data was breached, because they're the people who can say, hey, I was harmed by this, and so they could go to the Office of Civil Rights and they can file a complaint.
Okay. And they do that? They know that they can do that? Do they band together and do that? Do they get lawyers involved? How does it work?
The answer to all those questions is yes.
Yes. Okay.
Some people do that. Some people do it because they're upset and disgruntled, so they're looking for any way that they can go out and harm the organization or do whatever they need to do to get whatever they see as justice. There, other folks will contact a lawyer first, and the lawyer will usually advise them to go do that as a first step. For example, sometimes they're told to do it because they'll go to the healthcare organization themselves. They want to lodge a complaint, and the healthcare organization will say, here's HIPAA and the rules, and maybe refer them that way too. But yeah, so people get there through lots of different ways. Then there's an online portal you can use to lodge the complaints and that kind of stuff. And in fact, the OCR keeps HIPAA also has this provision for publicizing the enforcement actions taken by the government. So you can actually go out to the Health and Human Services site, and they actually have they call it the Wall of Shame, which is kind of the colloquial term for it. But it's a list of all the organizations that have done those mandatory reportings, and it's updated daily. I mean, if you go look now, there's stuff just reported within the last week for organizations that had reportable breaches that they have to deal with.
Yeah, and if you feel you need to make a complaint, here's the URL right up here above me. This one. Go there. That's where you start your journey.
Yep. And Jordan, just to clarify, I'm kind of curious. I mean, does it have to be an actual impacted party? So does it have to be a patient? It was my understanding that even external researchers, or even more so internal whistleblowers, can also file complaints.
Yeah, I think anybody can file a complaint, but I'm not sure everybody has maybe the. Yeah, to be honest, I'd have to go look up the details there. I'm not sure what it is. I know it's not just the patients. To your point, independent researchers, anybody that has a feel that the organization isn't meeting their obligations under HIPAA can probably make the report, and I'm sure that would be investigated if it looks reasonable. But I'm not sure exactly what the limits are. I'd have to actually go look them up.
Yeah. Jordan, I'm kind of curious, as we were talking about just some of the high level rules, I was actually, what can we talk about from just a pragmatic standpoint? Like, what should practitioners, especially on security teams, kind of be aware of? When I think about, other regulations like PCI, et cetera, we kind of have some broad frameworks of which people actually understand, like, oh, hey, create a PCI zone, tokenization, et cetera. What are some of the pragmatic things that, security teams should be thinking about today when it comes to HIPAA?
Absolutely. So that's a great question. So HIPAA itself, the security rule at a high level is you need to assess the reasonably anticipated risks to EPHI and take steps to address them. The security rule outlines specific things that organizations need to have in place, and these could be those things that organizations should be looking at today. Things like access control for PHI, making sure that only the people who need access to the healthcare data in order to do their job can actually are the only folks that can access that data in order to do their job. There's even some additional rules about who's accessing which records and when. And we should talk a little bit more about privacy monitoring in a bit, because that's kind of one of the big gap areas in healthcare space. But access control. HIPAA has a whole specific section about workforce training. So not just the typical security awareness training everybody goes through, but actually telling people, good hygiene practices. HIPAA requires that you tell people how to select good passwords, for example. That's actually one of the elements that's supposed to be part of that education that's included in the security rule. You have to train your workforce and actually evaluate your controls periodically too. So like I said before, you have to assess the risk for reasonably anticipated threats to PHI. You have to periodically revalidate both from an administrative standpoint. So have you selected the right controls? Do you have the right procedures in place? Do you have the right systems in place? And a technical perspective, hey, you've implemented a firewall. Is it really protecting your network? You have to test those things. That HIPAA requires that as well. It requires physical safeguards to protect the equipment. So this isn't just keeping workstations from being stolen, but it's also about there's some provisions in there about making sure that these systems are, that everybody or the people within an organization uses to deal with PHI are actually themselves in an area that's secure and controlled access and stuff, so that somebody couldn't, shoulder surf or walk up behind somebody and just, get access to records because they left it unlocked, for example.
I love your last point there, and it's actually something I would love to actually dive in and get your perspective on, especially since we're still dealing with this global pandemic, and that's been requiring people to actually work from home. And I'm actually kind of curious, like, how you think about this idea of working from home combined with people actually dealing with PHI and some of the HIPAA regulations. Is it even possible for somebody to actually be dealing with HIPAA data and also working at home and be compliant at the same time?
So yeah, the short answer to that question is absolutely it's possible. So one of the things that people may not have recognized before everybody was working from home from COVID is that entire classes of healthcare workforce, so a lot of times medical coders, so the people that are actually responsible for making sure that your medical bills and the things that your insurance is being billed for actually meet those standards for sharing that information we talked about before, as well as transcriptionists. So your doctor dictates into a system, and if there's an actual person that's transcribing that information, as opposed to these days it's done by computer programs usually, they've been working from home for decades.
Yep.
So let's talk about that real quick. With us coming out of the recent pandemic, point blank question: is it a prescribed HIPAA violation if an employer or somebody else asks to see a COVID vaccination card?
No, they're not a covered entity, and as a patient, you can always say yes or no, but it's not a HIPAA violation for them to ask that question. It may violate other state confidentiality rules. So, for example, in the
depending
states of depending on the state. So, like, one of the things that I had a recent discussion with a classmate about has to do with the definition of medical practice in the state of California, state of Washington, and they were talking about how they were going to a restaurant during the COVID era, and before anybody could enter that restaurant, they were taking customers' temperatures. That's actually practicing medicine and against the law in the state of California for them to do that, at least as far as we could tell. But asking for that information is not necessarily a HIPAA violation. It would be a HIPAA violation if your employer called your doctor to ask for proof that you weren't infected with HIPAA and your doctor gave them the details without your permission. That would be a HIPAA violation.
Yes, because being infected by HIPAA.
Yeah.
Perfect. So if you guys don't mind, I sort of want to bring together a lot of the issues that we have noticed inside of HIPAA. And in doing some of the research before getting on the show, I came across an article that I'm going to put up in the Discord. And if you're not in the Discord, then you're missing out on the article. But it does a really good job at codification of the challenges that we're seeing for HIPAA. And more specifically, the technical challenges, the administrative challenges for HIPAA compliance, the physical challenges for compliance, risk analysis, and policy and procedure documentation challenges. And you had mentioned earlier about access control and dealing with policies. And, that's part of the subsection, but that technical challenges for HIPAA compliance really breaks down into access control, audit controls, data integrity, and data transfer, right? So how are you working with clients to understand access, audit, data integrity, and data transfer while hitting all of the other areas like under physical, secure facility, workstation security, device security, versus the administrative, which you were talking about earlier, which is training, establishing process, security control, oversight, and ongoing assessment? How are you manipulating the multiple bullseyes so that way you can throw the dart and have it hit all of those to be able to protect clients? Like, what is the thought process there?
The thought process there has to do with the fact that under the security rule and the privacy rule, HIPAA cares about who needs access to PHI in order to actually do their job. So it starts with the classic, I'm going to say role-based discussion, but it's not entirely role-based. We can talk about that in a little bit. But the idea really is understanding who needs access to it, what they need access to, and where they need access to it. That's where you start. Once you understand those pieces, then it starts getting down to, okay, so we know where and what they need access to, and we need to know how they're going to get access to it. And that kind of informs what other decisions and controls we need to place getting at that physical security stuff like we were talking about before, or like I mentioned before, or the kinds of access controls that need to be in place. On top of that, that auditing requirement is something, and I mentioned before, that's kind of a common gap in the in the HIPAA world, and it's because traditionally security auditing is about monitoring user activity. So users are, the principles for, on a system that touch different things. In the HIPAA world, you have to be able to tie that activity back to a person, not a user account, but an individual person. And it's not just that you need to track the activity that they're doing on a computer system, what actions they're taking, what data they're touching, that kind of stuff. You have to actually be able to determine, is their access of that specific patient's record appropriate or not? Or are now we talking about privacy rule violations? I often work with organizations to talk to them about, look, you're familiar maybe with security monitoring because you're PCI compliant, or maybe you've got an ISO validated or certified security management system, whatever else. Let's talk about how we expand that into privacy monitoring, because that's an area where it's a little bit harder to draw the correlations between user account activity and the data that a person is looking at. But it's really, really important. Some of the most egregious HIPAA violations that have been in the news recently have been things like inappropriate access for maybe a healthcare provider was looking at the records of their friends or neighbors or that kind of stuff going back 10 years, and it wasn't noticed in part of their monitoring system because the activity didn't look malicious or unusual from a security perspective. In other words, they were a healthcare provider. They had access to that information. So it wasn't necessarily flagged as a security problem, even though it was definitely a privacy problem.
It's funny you'd say that, because there recently was a Supreme Court case where a police officer, and I think we actually talked about it on the show,
we did,
where a police officer had access to their cruiser's computer, which means that they had access to the system, and then utilize that system to make money out of band of being a public servant. So is that really a misuse? Because according to the Supreme Court, it's not, because they have access to it.
So without getting into the details of that specific thing, HIPAA actually has a little bit different prohibitions against that kind of stuff than CJIS, the criminal justice kind of stuff, does. But yes, for a health provider to access somebody's patient health information that they have a technical right to do, but they don't have a need to do at the time or a purpose to do at the time related to caring for or they care for that individual patient is potentially a privacy violation. There are exceptions. I mean, to everything. That the privacy rule has carve outs for things needed to improve, healthcare operations. Some of the statistics I was talking before about, quality monitoring and improvement and workflow management and that kind of stuff. I mean, those exceptions apply in the healthcare space. Things for public health purposes, some research related to public health purposes and that kind of stuff. But for a doctor to it gets a little bit of a gray area, but for a doctor to compile a list of, say, their patients that have a certain, disorder like diabetes we were talking about before, right? It's allowable with consent for that doctor to use that data to talk to those patients about additional services that can help improve their state of care. But it's not necessarily legal for that doctor to take that information and then sell or give it to a third party to market to those people for unrelated reasons. And it's there's a lot of caveats about that whole arrangement there, but to your original question, it's probably a violation under HIPAA for somebody to do the same kind of thing.
Right. Now, I want to switch. I want to switch real quick over to the marketplace itself. Prior to HIPAA, this was not this was a known issue, but post HIPAA, we see a lot of companies that are trying to stay in compliance, but they're hitting challenges with the risk analysis of not enough manpower, not enough time. So time, money, budget, resources. That's always been a systemic issue. In the past couple of years, and here comes the question, in the past couple of years, have you seen businesses address the time, budget, money, resources problem, or are they just hedging their bet and saying, well, we're going with something like I don't know, Epic?
So Epic's a kind of an interesting example because Epic is incredibly expensive. But
what is Epic, real quick?
So Epic is a healthcare information system that works mostly for hospitals. So when you go to the doctor and they use a computer to deal with your records, to order meds, to treatment for you, for charting, for doing all of that kind of stuff, if you go to a hospital in the U.S., they're probably using, Epic or sometimes Cerner or other kind of system to do that kind of stuff.
Yeah.
Okay.
They're called EMRs, electronic medical record systems. They do a lot more than just the medical records, though. They do the medication, as you mentioned, and they're a full practice management system for hospitals, medical care, et cetera.
Yeah, practice health record management. I mean, they're huge systems, but that's kind of what those are. So so back to your question, what I see is two kind of approaches there. One of the reasons we have a lot of problems related to HIPAA is some organizations maybe underestimate those resource requirements in order to meet the rules. HIPAA doesn't necessarily have a call out like in PCI. You can, if you can't meet a control, and it's a legitimate business constraint for it because it's too costly. It doesn't, the risk is too low or whatever else. Risk is probably a bad example, but if it's too costly, you can devise a compensated control to meet that requirement, deal with it anyway. HIPAA doesn't really have that idea. It does have the idea that certain controls or certain safeguards required under the security rule are addressable, which means you don't necessarily have to do exactly what's in the law, but you have to do something to address whatever that thing is. It doesn't mean you can ignore it. It means you have to do something. So
right. So are you seeing companies like devote time, budget, money, resources towards this, or are they just hedging their bet and saying we're gonna push our risk off our dock?
So I've seen folks head down the route of relying on cloud service providers to offload the need to do some of that control. So cloud-based EHR systems, not Epic necessarily because Epic isn't cloud-based, but some of the other ones that are, so that the management of that aspect of the system is actually outsourced to a third party, which is one of the ways that they've been able to save a lot of kind of money constraints there. On the other side, it's not that folks have just put off assuming it wasn't going to be a problem. I think this is a classic example of it's going to be too costly. They don't fully understand or think it's going to matter to them, so they ignore it and let somebody else make that plan for them. It's not necessarily an informed choice not to do anything, I think, fully informed choice, but often those things are let to go because from a healthcare provider's point of view, especially if they're a doctor who has a private practice or they're smaller organizations or whatever, it's not the primary, it's not why their organization exists. It's not the primary thing that they do. I have seen some organizations stay completely on paper records because it reduces the amount of things that they have to comply with. It just complicates things and prevents them from being able to deal with third party, with other healthcare organizations and insurance companies and that kind of stuff as well.
Flea, you had a question?
Yeah, it's a two-part question, Jordan. Coming back to something a little bit more pragmatic, I'm actually kind of curious. I'm just going to put you on the spot here. What would be like the top 5 things that you think people misunderstand about HIPAA? And then also, what are kind of like the top 5 things you commonly see companies get wrong in the implementation of some of their controls?
Sure. So the top things that folks misunderstand or get wrong about HIPAA is, one, who it applies to. Some people think it's a general privacy regulation like GDPR or California's CCPA but it's not. It only applies to certain organizations who, as I said before, they create or they receive protected health information related to dealing with somebody. So there's a lot of kind of misunderstanding there. There's a lot of misunderstanding about, I mentioned before that HIPAA has some things in the security rule that are addressable. So in the security rule, the required safeguards are either required. In other words, you have to do what the law says specifically related to protecting that thing, like access control and that kind of stuff, or they're addressable, like encryption, for example. If encryption is the best way to protect the confidentiality and integrity of PHI, then you should do that. But if it's not the only way to do it, if you can rely on better access controls or something else, you don't necessarily have to encrypt the data. That's anyway. The details there matter later, but. Some people think, some organizations for a long time thought that, well, if a requirement was addressable, that meant it was optional. It's absolutely not optional. You have to do something to achieve whatever the goal of that safeguard was. those are probably the most important or most common misconceptions about HIPAA. One of them is I'll say it's about kind of both things. That's both a common misconception about what HIPAA requires and something I see a gap a lot, which is what I mentioned before, that activity monitoring, that logging piece. A lot of organizations, especially in the IT world, understand that from a system activity and a security monitoring perspective. But a lot of health organizations don't necessarily take that a step further to do adequate privacy monitoring. In other words, are your staff accessing only the records they need to for the right purposes? A classic example there is, are you checking that the providers in your organization, for example, aren't accessing patient records with the same last name as the provider? Are they looking up their family members, their kids, their neighbors, that kind of stuff? When they're not, shouldn't be, because they're not the ones treating those patients. Are they looking up the records for patients who have the same address, either as one patient or another? There's a certain kind of another rule in HIPAA, and this one's a little less gotten wrong, but it's kind of related to that same thing, which is VIP patients. So it's possible under HIPAA for a patient to do what they call opt-out, which is basically to say, I don't want the health organization to disclose even that I'm here or what my condition is, that kind of stuff. So like when you hear on the news and they say, the person's in the hospital and they're in satisfactory condition. There's a specific, HIPAA actually allows health organizations to identify the person's last name, their first initial, the date they were admitted, their general status, so satisfactory, critical, otherwise,
alive,
and the date
dead.
they were admitted.
Yeah,
basically.
Okay.
Yeah.
That is a status, yes.
It is.
Yeah, the basic status. Yeah, dead or alive would be a status, I suppose. But looking up records for those VIP patients, if you are a healthcare worker or just another employee, it could be an operational worker like a environmental services or food services, something in a hospital, and that famous actor is staying there, Robert De Niro or Jeff Mann or somebody that's really well known is staying there. Looking up their records when you're not part of treating that is a privacy violation under HIPAA. And healthcare organizations, I think, even today, misunderstand the fact that they actually need to be on the lookout for things and take reasonable steps to prevent their people from doing that. It's not enough to say, our folks aren't going to do that because they're good people. That's fantastic, but you have to be able to back that up somehow.
What I'm hearing is, go ahead, Flea.
Oh, no, I was just kind of, just want to take it a step further because, HIPAA just seems like something that's really, really poorly understood in the industry. And I'm kind of curious, where would you point somebody towards who actually really just need help and actually really kind of get them further educated on HIPAA, better ways to actually implement some of these things in a practical standpoint inside of their organizations? Sure.
So the best place to go that I've always sent people to first is actually Health and Human Services website. They have a link on their website specifically related to HIPAA for individuals, for patients who want to learn more about it, and for professionals who want to learn more about it. And the government doesn't always do a very good job of describing these things, but as these pages and as the information I've got on has evolved over the past, HIPAA was the HIPAA law itself was passed in 1996. Enforcement for the first provision started in 2003. It's been around for a while, and they've done a lot to make that information more consumable, more readily available for folks. That's probably the best place to start. There's a lot of other online resources, but to be honest, I haven't found any of them that are as comprehensive, as well described, or as succinct as what Health and Human Services actually publishes themselves, which is probably the one and only time I'll ever say go to the government agency first.
If you get nothing out of today's episode, remember that.
That's right. Yeah. If you go to hhs.gov, of course now they've buried the lead. It used to be right on the top of their page, but if you go to hhs.gov/HIPAA, and that's HIPAA, not HIPPA, you can see links to specifically to HIPAA for individuals, that link for filing complaints right there on the main page, all that kind of stuff. And that's probably the best place to start.
What I'm hearing is, and I tie everything back to PCI just because I'm more familiar with PCI. It sounds like where HIPAA is, and organizations that are needing to do HIPAA, where they're uniquely challenged is we tend to think of the big compromises, the big breaches. How many years ago was it when Anthem got into trouble because they lost all their PII? It wasn't even necessarily technically a HIPAA violation, but we tend to think in terms of protecting the systems and protecting the the storehouses, the warehouses, the databases of all the data, whereas it seems like HIPAA is a lot more focused on individual, onesie, twosie compromises, misuses and abuses and disclosures of data. And that's challenging. I think that's what we're getting at.
I mentioned before that a lot of other privacy regs kind of tie some of their ordinance back to HIPAA, and a lot of that gets down to the fact that the reason HIPAA mandates security for protecting PHI and the privacy rules for ensuring it's only used for the things it's supposed to be used for is about protecting individual people from being abused or having their information stolen. It's not about the system. It's about the individuals and the understanding that data is highly sensitive. It's things that people care a lot about, and we need to treat it accordingly. And that's kind of one of the underlying premises on that. And that's one of the, as you said, that's one of the big differences, is that it's not about the data, the records of the data. It's about the people affected by it.
Wow. Any other questions from any of my illustrious co-hosts?
Very cool stuff. Thank you.
You've given us
actually, I do have one more question.
Please.
Obviously, I'm this is a subject I really like. And there are pathways for people who actually want to get into the world of PCI, doing audits and things like that. I'm actually kind of curious, like
assessments,
assessments. Having dealt with people that do HIPAA assessments, I'm kind of curious, like, what would somebody need to go through for them to actually effectively get at your level, Jordan? And if they actually wanted to go into the world of, being actually do HIPAA assessments, like, what are some of the things that they should be looking into? Where can they get additional training? Those kind of things, et cetera.
Sure. So the resources on the HHS website, like I said, are kind of a good place for anybody to start that wants to learn more about HIPAA. I would kind of turn this one a little bit on its head in that there aren't a lot of good third-party education programs dedicated to HIPAA compliance. Somebody mentioned HITRUST before. I forgot who said that. They're a private organization, kind of a partnership with a bunch of healthcare organizations to create more of that HIPAA compliance standard. Not just HIPAA. HITRUST is cross-standard. That's not necessarily a bad place to start. It's a great idea. But it's also super expensive.
It's also really, really fucking expensive.
Yeah. And maybe overblown for smaller organizations. One of the elements that is really, really important for HIPAA is if you've already got some security skills and you already understand the technical side of stuff there, go work in healthcare. Healthcare is an interesting business in that there are competing, often conflicting, dual objectives for a business. It's not just about a profit and making money. It's about saving people's lives. And sometimes those two things are conflict with each other. And you have to gain an understanding of what that looks like and when you make which decisions. And you're not really going to get that outside of working in healthcare itself. Most of what I understand, especially about the practical applications of this thing, is because I worked for providers, because I was in that space. And it's also one of the reasons that there's not a lot of really good training programs for that kind of stuff, because it's not enough to focus on just protecting the information itself. As we said, this is about protecting individuals. Need to understand that perspective. So that's kind of my opinion on the subject. I'm sure there's other people out there that can point to specific classes. There's a lot of universities now offering courses in healthcare informatics. There's even some certification programs in healthcare informatics that will touch on security and risk and privacy concerns. But in my experience, none of them have been as effective as being an IT professional, an engineering professional, a security professional working in healthcare and seeing it from that perspective. It's one of the few areas where getting your hands dirty is the best way to understand how to prevent them from getting too dirty later.
So what about somebody who works for a mobile carrier that deploys 5G? Does that count as healthcare?
No, healthcare.
No, that's a vaccination site. That's what that's called.
Right. Too soon. Jordan, I think you've given us some final thoughts, but I will give you one last moment to give us any parting nuggets of wisdom.
Sure. Kind of to Flea's question earlier about common misconceptions and common things that are got wrong. One area to spend some time about, and I feel like especially these days we can't focus enough on this, is the impact of ransomware on healthcare organizations, because it seems like every other week we hear about another one getting infected with ransomware. So two things. First, HHS released guidance with Office of Rights a while back that yes, a ransomware infection is potentially a reportable breach if you can't prove that the bad guys didn't actually have inappropriate access to the health data, because if they've encrypted it and they control it, they have unauthorized access to it, and they've taken your control for it to use it for unauthorized purposes. So that matters a lot. The second aspect of that has to do with, we've harped a lot in the security world on this idea of least privilege access and that kind of stuff. Well, HIPAA is one of the few areas, or with health data specifically, where if somebody doesn't need access to it, or you don't need to be storing it on one system, don't do it. That can help limit the impact of ransomware spreading through your environment, because if Joe user gets infected with ransomware and they don't actually have access to the other systems, so the ransomware can't spread to their back on the EHR systems, well, guess what? You've protected the patient information, maybe the viability of that business too. So getting those kinds of least privilege things right the first time can be a really, really important step in preventing that from happening, in addition to training users and patching systems and all of that kind of stuff. So we didn't spend a lot of time on the ransomware side here, but yeah, it's getting kind of nuts, and people need to take it a little bit more seriously, I think.
Well, I'm okay with that, because that's been kind of in the news lately, and it's been a popular topic, and I didn't want to just be a retread and be yet another venue for talking about ransomware. There's plenty of resources out there for that. I appreciate that we've gone down different avenues, and hopefully have given all of our listeners, and well, I can speak for myself, I've learned some things today. I think all of us as the co-hosts, we've learned a little bit. So absolutely. Jordan, thank you so much for joining us today and giving us an opportunity to focus on an area that we hear about all the time, but at least on this show, we haven't really talked about a lot. So appreciate you coming on. Time for us to get back to work. Take care.